Hello, my name is Sarah Yacoub, and I'd like to welcome you to the CDC Private Sector Call, an update on the COVID-19 response. We'd like to thank you for doing all that you are to help protect your employees and communities during this unprecedented time. This call will be recorded and later posted on the CDC COVID website. This call is not intended for media. Media can direct their questions to media@cdc.gov. Before we begin, I'd like to recommend all call participants refer to the CDC COVID website for the latest information, guidance, and communication resources. Just since our call last Monday, documents that have been updated and posted online include Youth Experiencing Homelessness, Framework for Healthcare Systems Providing Non-COVID-19 Clinical Care During COVID-19 Pandemic, COVID-19 Serology Surveillance, and various resources updated, including support for states, tribes, and localities and territories. Our plan today is to hear a situational update from a leader in our response, followed by information pertaining to considerations for public pools, hot tubs, and water playgrounds. We'll then have ample time for Q&A. So thank you to those who sent questions in advance. I'll also be keeping an eye on the Q&A box, so please feel welcome to submit questions there. I am so pleased to be joined here today by Dr. Grant Baldwin and Dr. Jennifer Murphy. Dr. Grant Baldwin is the Community and At-Risk Task Force co-lead for the CDC's COVID-19 response. Dr. Baldwin is also the Director of the Division of Overdose Prevention at the National Center for Injury and Prevention and Control at CDC. Dr. Baldwin has served at CDC for over 20 years. He received his PhD in Health Behavior and Health Education at the University of Michigan. He received an MPH in Behavioral Science and Health Education from Emory University and is currently an affiliated professor at Emory University. Dr. Jennifer Murphy is currently the Water Sanitation and Hygiene Team Lead in the CDC's COVID-19 response. And outside of the response, she serves as a CDC's Environmental Microbiology and Engineering Team Lead in the Waterborne Disease Prevention Branch. She has over 20 years' experience in research. She has also participated in CD waterborne disease outbreak response, both domestically and internationally, as well as performed laboratory-based studies of disinfectants for use in waterborne disease outbreak prevention and response. I'll now turn it over to Dr. Grant Baldwin to share a situational update, as well as details about the great work that's coming out of the Community Intervention and At-Risk Task Force. Dr. Baldwin.
Great, thank you, Sarah, and thank you all for joining today. As Sarah mentioned, my name is Grant Baldwin. I co-lead our Community Intervention and At-Risk Task Force. Within the task force and across CDC, we continue to work closely with the White House Coronavirus Task Force, federal partners, and other stakeholders across the U.S. to help slow the spread of COVID-19 and to ensure that communities remain safe, healthy, and resilient, and that we get to stay on a path for long-term recovery. There are currently 57 jurisdictions, all 50 states, DC, the Commonwealth of the Northern Mariana Islands, Guam, Puerto Rico, the US Virgin Islands, and the Navajo Nation all reported COVID-19 cases to CDC. As of today, 1,475,030 cases that have been confirmed or probable cases in the US have been reported to CDC, including 19,820 new cases. And this is difficult news for me to share, but there have been 89,249 deaths in the US, including 868 new deaths since last reporting. We continue to see outbreaks in high-risk settings across the country. These include long-term care facilities, departments of corrections and other prisons, the food industry, and among homeless populations. CDC is actively engaged in the whole of government approach to keep America open safely and efficiently, and providing critical information about COVID-19, including surveillance data about the number of cases throughout the country. We're also providing substantial direct and tailored technical assistance and robust supports to state, territorial, local, and tribal health departments as they consider approaches to mitigate and contain COVID-19 and adjust mitigation strategies if needed. To date, we have 1,067 staff deployed to 105 cities across the United States and abroad. In addition to ongoing technical assistance, CDC's top priorities is getting funds to state, local, territorial, and tribal public health organizations to allow them to surge to meet the challenges of the response. A remarkable $10.25 billion is going to jurisdictions within the next 5 days before May 23rd, 2020. Mitigation and containment of COVID-19 are the key to keep America open, and CDC is committed to leveraging our expertise and partnering with others on the front line. So one of our primary goals of the task force is to collaborate closely with state, local, tribal, and territorial governments across the US as they determine when and how to adjust community mitigation efforts. As you know, community mitigations is a set of actions that people and communities can take to slow the spread of viruses like SARS-CoV-2, and community mitigation is especially important before a vaccine or drug becomes widely available. Community-based interventions include personal protective measures, community measures that support social distancing, and environmental measures. Personal protective measures are things like voluntarily home isolating yourself if you're an ill person, voluntary home quarantine of exposed household members, covering coughs and sneezes, using cloth face coverings in community settings, practicing hand hygiene, and remaining 6 feet apart from others. Community measures aimed at increasing social distancing are steps like temporary school dismissals, social distancing in workplaces like working remotely, and postponing or canceling mass gatherings. And environmental measures such as routine cleaning and disinfection of infrequently touched objects or surfaces. So as states and communities ease stay-at-home orders, it does not mean the COVID-19 threat is over. We continue to enhance our support by providing TA to communities to build and maintain a core capacity to respond to and manage COVID-19, particularly if a community has experienced significant transmission and there is a risk of health system capacity being exceeded. When we talk about what community mitigation might look like, it's difficult to have a cookie-cutter approach because each community is unique. Appropriate mitigation strategies should be based on the best available data. Decision-making will vary based on the level of community transmission and local circumstances. Mitigation activities will differ based upon the degree of disease spread within the community, community characteristics and its populations, and the ability to implement preventive strategies at the local level. As communities adjust mitigation strategies, they should ensure healthcare and public health system capacity will not be exceeded. Of course, precautions should be taken to protect healthcare professionals and other critical infrastructure workers. CDC is reimagining how to provide more specific community mitigation with a presumption of opening and appropriate deference to local circumstances. We are providing best practice considerations while also recognizing issues of feasibility, practicality, and acceptability. Any signs of a cluster of new cases or a reemergence of broader community transmission should result in a reevaluation of community mitigation strategies and a decision on whether and how mitigation might need to change. Attention should be given to people who are at higher risk of severe illness when determining and prior to adjusting community mitigation strategies. All told, the goal is to meet local jurisdictions where they are. In the last few days, CDC posted new resources. This includes decision trees that we released last Thursday, and yesterday we released interim setting-specific guidance that aligns with the Opening Up America Again plan. Let me say a little more about those decision trees. We released them for camps, schools, childcare, mass transit, restaurants and bars, and workplaces with employees at higher risk for severe COVID-19 illness. They aim to help decision makers determine if and when to open. Using a set of easy-to-follow prompts, the tools walk you through fundamental questions and issues you should consider prior to opening, like, will reopening be consistent with applicable state and local orders? Next, the tool probes about recommended health and safety actions and the availability of ongoing monitoring. If a decision maker can answer affirmatively to each prompt, then a venue is in a position to consider opening and monitoring the situation. Of course, adjusting community mitigation as local circumstances demand. The decision trees are a companion implementation tool to the interim setting specific guidance for reopening. The latter provides greater detail and specificity and risk stratification for each setting or sector. It lists specific practices that state and local health departments, as well as other stakeholders, may find helpful at particular stages of the COVID-19 outbreak, again, with appropriate deference to local context, as well as state and local regulations and directives. I also wanted to make you aware of a set of consideration documents that we were working on and aim to release in the coming week, including highly sought after and timely ones on youth sports, institutes for higher education, and summer camps. These resources include actions to help community leaders work through mitigation when they have already opened. It starts with the presumption of being open, unlike the decision trees and the interim guidance I mentioned earlier. And we already have one consideration document out, and that is the focus of our call: considerations for public pools, hot tubs, and water playgrounds. Of course, these are venues that are top of mind to many people right now because the summer is right around the corner. And these considerations were released May 8th and can be found on our website. With that as an introduction, it's my great pleasure to introduce Dr. Jennifer Murphy, who is the team lead for the water, sanitation, and hygiene team within my task force. Dr. Murphy?
Thank you, Grant. I'm pleased to be here today to provide additional information about this new resource that suggests practical ways all public aquatic venues can help prevent the spread of COVID-19. There are four main categories that our considerations fall into. These are promoting behaviors that prevent the spread of COVID-19, maintaining healthy environments, maintaining healthy operations, and preparing for when someone gets sick. For promoting behaviors that prevent the spread of COVID-19, some of the strategies we include are encouraging healthy hygiene. So this includes hand hygiene, respiratory etiquette, and the use of cloth face coverings as feasible, especially when physical distancing is difficult. Please note, those wearing cloth face coverings should not wear them in the water. These can be difficult to breathe through when they're wet. Another strategy includes educating staff, patrons, and swimmers about when to stay home. This means staying home if they have symptoms of COVID-19, have tested positive for COVID-19, or were exposed to someone with COVID-19 within the last 14 days, and also educating them when they can end their home isolation. We also recommend ensuring adequate supplies are available to support healthy hygiene, such as soap, hand sanitizer with at least 60% alcohol, paper towels, tissues, and no-touch trash cans. Another consideration is communicating messages about prevention by posting signs and broadcasting announcements on PA systems about how to stop the spread, as well as providing messages about behaviors that prevent the spread of COVID-19 via email and social media. Please note, CDC web pages have printable signs, downloadable recorded announcements, videos, and social media messages that can be used for many different communications messaging. These communication products can be found on our web pages at cdc.gov/coronavirus. The considerations document also provides detailed suggestions for ways pools and aquatics facilities can maintain healthy environments safely, including cleaning and disinfecting frequently touched surfaces, such as handrails, handles, restroom surfaces, hand washing stations, diaper changing stations, lounge chairs, tabletops, pool noodles, kickboards, slides, and structures for climbing and playing. The document also suggests that operators consult with a company or engineer that designed the aquatic venue to decide which disinfectants approved by the U.S. Environmental Protection Agency for use against SARS-CoV-2 are best. These considerations also suggest changing deck layouts to ensure that in the standing and seating areas, individuals can remain at least 6 feet apart from those they don't live with. Other considerations for ensuring adequate social distancing include providing physical cues or guides, for example, lane lines in the water or chairs and tables on the deck, and visual cues, for example, tape on the decks, floors, or sidewalks, as well as signs to ensure that staff, patrons, and swimmers stay at least 6 feet apart from those they don't live with, both in and out of the water. The guidance discourages the use of shared objects. These objects include ones that are difficult to clean and disinfect or that are meant to come into contact with the face, such as nose clips or goggles. Facilities can also ensure adequate equipment for patrons, such as kickboards or pool noodles, to minimize sharing to the extent possible, or limiting the use of equipment by one group of users at a time, and cleaning and disinfecting between use. Other recommendations include setting up systems so that contaminated items are properly separated, cleaned and disinfected, and labeling containers for used equipment that has not yet been cleaned and disinfected. The document also outlines considerations for maintaining healthy operations, such as ensuring protections for vulnerable staff, staggering or rotating shifts to limit the number of staff present at the venue at the same time, and designating a staff member to be responsible for COVID-19 concerns. In order to maintain water safety, we suggest ensuring that lifeguards who are actively lifeguarding are also not expected to monitor hand washing, the use of cloth face coverings, or social distancing of others. These monitoring responsibilities should be assigned to other staff. The considerations also suggest avoiding group events, gatherings, or meetings, both in and out of the water, if social distancing of at least 6 feet between people who don't live together cannot be maintained. Of course, exceptions should be made for anyone rescuing a distressed swimmer, providing first aid, or performing CPR. Maintaining healthy operations in aquatics venues also includes putting systems in place for having staff, patrons, and swimmers self-report if they have COVID-19 symptoms, a positive test, or if they were exposed to someone with COVID-19 within the last 14 days. The document also suggests ways aquatic operators can recognize COVID-19 signs and symptoms early, for example, by conducting daily health staff checks that are respectfully implemented and aligned with any applicable privacy laws and regulations. Having a designated staff member to be responsible for responding to COVID-19 concerns can also help with this task. Finally, the document offers aquatic venue operators strategies for preparing for if someone gets sick. This includes immediately separating staff, patrons, or swimmers with COVID-19 symptoms, establishing procedures to safely transport those who are sick to their home or a healthcare provider, notifying health officials, closing off areas used by a sick person, and not using the areas until after cleaning and disinfecting them. These are just a few of the considerations available, and much more detail is available in the document online. You can get to it by searching aquatic venue in CDC or through the main pages at cdc.gov/COVID. I'll stop there and turn this back to Sarah to take your questions.
Great. Thank you, Jennifer, and thank you, Grant, for that opener. So we'll go ahead and dive into some questions. The first one being for Grant. So we've received some questions about why African Americans may be more likely to experience some of the negative outcomes to COVID-19. Can you share a little bit about why that is?
Yeah, thanks for the question, Sarah. It's a difficult one. So the conditions in which people live, learn, work, and play contribute to our health, and these conditions over time lead to different levels of health risks, needs, and outcomes among all of us, including African Americans. Health differences among African Americans are often due to economic and social conditions. In public health emergencies, these conditions can isolate people from the resources they need to prepare for and respond to outbreaks. Social factors can also increase African Americans' risks for chronic diseases, such as heart disease, obesity, and diabetes, linked to more severe outcomes in COVID-19. Stigma and racial profiling undermine prevention efforts, increase levels of chronic and toxic stress, and ultimately impact the health disparities that we've observed. Members of racial and ethnic minorities may be more likely to live in densely populated areas because of institutional racism in the form of residential housing segregation. People living in densely populated areas may find it more difficult to practice prevention measures such as social distancing and others that Jen and I have just outlined. African Americans are more likely to live in neighborhoods that are further from grocery stores and medical facilities, making it more difficult to receive care if sick and stock up on supplies that would allow them to stay home. Research also suggests that racial residential segregation is a fundamental cause of health disparities. So for example, racial residential segregation is linked with a wide variety of adverse health outcomes and underlying health conditions. These underlying conditions can also increase the likelihood of severe illness from COVID-19. Racial and ethnic minority groups are often overrepresented in jails, prisons, and other detention centers, which have a specific risk due to congregate living, shared food service, and more. And workers without paid sick leave might be more likely to continue to work even when they are sick for any reason. This can increase workers' exposure to other workers who may have COVID-19, or in turn expose others if they themselves have COVID-19. Compared to whites, African Americans are almost twice as likely to be uninsured. In all age groups, Blacks were more likely than whites to report not being able to see a doctor in the past year because of cost. And we at CDC are very committed to reaching marginalized and disproportionately affected populations in this pandemic response. In fact, we recently stood up a minority health and rural health team on the COVID-19 response to address race, ethnicity, and rurality within my task force. We've also just appointed a chief equity officer. It's a tough question, Sarah.
No, thank you for that. You know, thinking about face coverings, we are entering the summertime, which is quite warm, depending on where you're at in the United States. And for some folks, it's just uncomfortable to wear masks, thinking about asthma and for other reasons. Can you share if a face shield could substitute for a mask?
Well, first, I want to thank all of those who are wearing cloth face coverings, or for what many people call face masks. Me wearing one protects you, and you wearing one protects me. In light of data about how COVID-19 spreads, along with evidence of widespread COVID-19 illness in communities across this country, CDC currently recommends that people wear a cloth face covering to cover their nose and mouth in community settings. This is, again, to protect people around you if you are infected but do not have symptoms. A cloth face covering is not considered personal protective equipment, or PPE. These items, like surgical masks and N95 respirators, are in short supply and should be reserved for healthcare workers or other medical first responders as recommended by current CDC guidance. Face shields are a type of PPE intended to protect the eyes and face against splashes and large droplets. They are recommended as part of the PPE for healthcare providers caring for those with confirmed or suspected COVID-19. And in healthcare settings, a face shield is not a substitute for a respirator or face mask, but should be used in conjunction with them. Regarding those cloth face coverings in the general public, I want to suggest a few things to make them more comfortable. First, try different forms of masks. For example, my second round of homemade cloth face coverings added a piece of pipe cleaner around the nose. This has reduced the number of times that glasses, unfortunately I have to wear glasses, that they fog up. I'm trying to wear them for my face covering for increasing longer periods of time so I can get used to it. Now the sensory and health concerns can also pose challenges. So for children or people with sensory issues, several partners have specific resources to help people adjust. For example, there's a really fabulous Sesame Street tool targeted for children. And I also try to limit the amount of time a cloth face covering is necessary. That is to say, when you're in close physical proximity to somebody else. I should also acknowledge that cloth face coverings should not be placed on someone, including young children, younger than the age of 2, anyone who has had trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the cover without assistance. So consider alternative options for employees who cannot wear a mask. Again, those things include things like telework, if there are private offices, keeping people 6 feet away from others, that would limit the need for masks to periods when folks are in common areas. And then flexible job assignments. Is there a different role that an individual could play that would limit their interaction with others, such as in the back room stocking items? And we will share if we learn something that changes or improves on these recommendations. But again, just want to appreciate folks' use of cloth face coverings. Over time, I anticipate will become a social norm for all of us as we weather this pandemic. It's something that myself and other members of my family are getting used to. My wife went out and bought some personalized face coverings. My son is really interested in baseball, so he has one with baseballs on the face covering. So I'd encourage you to customize them and tailor them to you and your family as is allowable.
Excellent, thank you. So still on the topic of face coverings, I'm going to switch gears a little bit and move over to Jen, asking if you're familiar with there being any fabrics that should be considered for a face mask, specifically when thinking about an aquatic setting.
Jen, you may be on mute.
Can you hear me now?
We can, yes, thank you.
Okay, so CDC provides some instructions on our website about how to easily make some cloth face coverings at home using cotton or t-shirts or bandanas. And as Grant mentioned, you can also modify these a little bit to make them fit your face a little bit better.
Excellent. Is there any signage that can inform folks of when face covering should be done, you know, when near water, when in water?
That's a great question. So we do have a variety of printable materials that provide a lot of information about how to protect yourself and how to protect others from COVID-19. And this includes how to safely wear the cloth face coverings. And we're currently in the process of designing some resources that are specific for aquatics venues. So stay tuned. Those should be posted up on the web sometime soon.
Excellent, great. I'm going to bounce back over to Grant and ask a question. Again, thinking about summertime and folks wanting to come together for parties. We've got the 4th of July coming up, Memorial Day. Just curious if you could talk a little bit more about group gatherings, if folks should be avoiding those situations.
Yeah, sure. And we know that some gatherings will continue to happen as different areas open up. But in general, we do suggest avoiding group events or gatherings or meetings both in and out of the water if social distancing of at least 6 feet between people who don't live together cannot be maintained. We also encourage proper hand hygiene and respiratory etiquette, using the cloth face coverings when needed, and cleaning and disinfecting frequently touched surfaces appropriately. There's a lot of different measures that you can put in place, and it's important to work with your local jurisdictions on how best to manage those gatherings. I'd also say that of all the prevention mitigation measures that Jen and I have talked about, one of the things that we're thinking about now at CDC is that it's not just one or the other, it's about layering these mitigation efforts on top of one another to confer even greater protection. So it's not just use of cloth face coverings and social distancing, it's that plus the cleaning and disinfection and some of the other practices and habits that we've described.
Excellent, thank you. We've got a lot of questions about pools. So Jen, I'm just gonna throw a number at you right now. So thinking about public pools, what would you consider to have on hand when it comes to supplies?
So I think one of the most important things you can have supplies-wise on hand are things that help support healthy hygiene. So this includes things like soap, hand sanitizer, again with at least 60% alcohol, paper towels, tissues, no-touch trash cans. These are really just supplies that can be considered for any aquatic establishment.
Okay, great. Do you have any thoughts or recommendations regarding indoor pools opening? Should indoor pools be opening at this time?
Yeah, we've gotten this question a few times. So we recommend that ventilation systems of indoor spaces operate properly, and you can increase the introduction and circulation of outdoor air as much as possible by opening windows and doors. You can also use fans, and there's other methods that people are using to do that. I think it's just important to remember not to open windows and doors if doing that poses a safety risk to the staff or the patrons or the swimmers.
And should folks be offering kickboards, pool noodles, different supplies that were used last summer? Is that something that should be offered?
Yeah, we recommend ensuring that there's adequate equipment for the patrons and swimmers. So that includes kickboards and pool noodles. You want to do that to minimize the sharing as much as possible, You can also just limit the use of equipment by one group of users at a time, and then make sure that you're cleaning and disinfecting that equipment in between users. We're also discouraging people from sharing items that are difficult to clean, sanitize, or disinfect, or items like goggles or nose clips or snorkels that are meant to come into direct contact with the face.
And should aquatic facilities consider removing slides or diving boards?
So that's when we recommend that you consult the company or the engineer that designed the aquatic venue before doing any kinds of alterations of your features. So that includes slides or any of the structures that are designed for climbing or playing.
Excellent, thank you. Are there any recommendations on waiting 24 hours before cleaning an area if, say, in an aquatic venue, they learn that someone that was there was sick? Is there anything that can be done as an alternative to closing?
Sure. So we have some guidance online for cleaning and disinfecting community facilities such as schools, daycares, businesses, after a person who's suspected or confirmed to have COVID-19 has been in that facility. So it's unknown how long the air inside a room occupied by someone with confirmed COVID-19 remains potentially infectious. So for indoor areas, facilities will just need to consider factors such as the size of the room, the type of ventilation system design, so that includes flow rate or the air changes per hour, and the location of the supply and exhaust vents when you're deciding how long to close off a room or areas used by ill persons before you start that cleaning and disinfecting. So taking measures to improve ventilation in an area or room where someone was ill or suspected to be ill will help shorten that time that it takes for those respiratory droplets to be removed from the air. So we do have some pretty good guidance online about cleaning and disinfecting these types of areas.
Great, thank you. Switching back over to Grant. Is a child with type 1 diabetes considered high risk for severe illness? Should these children be staying home from daycare? Do you have any thoughts on this specifically?
Yeah, sure. Happy to address that. But let me tackle a couple of questions that I'm seeing in the chat first, just to show that we're being attentive to those. A question was being asked about difficulty of maintaining social distancing among campers, and we're hoping to put out an updated considerations document for camps in the coming days or weeks. And among the things that you're likely to see in that document, in addition to pursuing social distancing, is limiting group size and or cohorting groups so that you're minimizing the exposure of one child to a smaller subset of children in that group. That's, again, as I was talking about a few minutes ago, some of that layering of protective measures that we're hoping to put in place in instances where maintaining social distance can be difficult over time. There's also a question asked about CDC's perspective on mass gatherings moving into the fall. The reality is that we're tracking changes in the pandemic daily right now, and we will evolve our considerations, materials, and guidance moving forward as the levels of community transmission over time. But at this point in time, again, my sense is that larger gatherings would be viable to the extent that social distancing can be maintained and that the other preventive precautions that we've talked about are put in place. But Sarah, let me get to your question about diabetic children. So first, I want to note that this is a highly personal decision and not an easy one. I'm also a parent. I have a soon-to-be 9-year-old, and he and my wife are the two most important people in my life. And of course, I'd do anything to protect both of them. But it's important to consult your healthcare provider for advice on your specific circumstances. What we know is that people of all ages with underlying medical conditions, particularly if they are not well controlled, may be at higher risk of severe illness. Diabetes, including type 1, type 2, or gestational diabetes, may put people at higher risk of severe illness from COVID-19. And this is because people with diabetes whose blood sugar levels are often higher than their target are more likely to have diabetes-related health problems. So those health problems can make it harder to overcome COVID-19. So we recommend that those with diabetes continue to take their diabetes pills and insulin as usual. Test your blood sugar every 4 hours and keep track of the results. Make sure that you have at least a 2-week supply of your diabetes pills and insulin, and follow the sick day guidelines for people with diabetes. I do want to also emphasize, however, that we are still learning about how COVID-19 affects children. And based on available evidence, children do not appear to be at a higher risk of COVID-19 than adults. While some children and infants have been sick with COVID-19, adults, as many folks know, make up the most of the known cases to date. Children with confirmed COVID-19 have generally shown mild symptoms. However, it's not known yet whether some children may be at higher risk for severe illness. We're learning new information every day. And for example, you probably heard we've begun to see multi-system inflammatory syndrome in children that resembles a disease called Kawasaki's disease. While it still seems rare, it's serious, and points out that we have a lot more to learn. In fact, we put out a health alert just last week on this. So in the meantime, there are steps that a parent can take to help their child stay healthy and stop the spread of COVID-19. Again, take steps to protect children and others from getting sick. So again, things we've talked about already: clean hands often, avoid people who are sick, clean and disinfect high-touch surfaces daily. This is especially important for children who are natural explorers, and of course, launder items. Limit time with other children, practicing social distancing, altering travel plans to make sure that can occur. Limit time with older adults and people with serious underlying medical conditions. And I want to reinforce a point I was trying to make earlier, and that is that children 2 years and older should wear a cloth face covering as is feasible in community settings. So apart from the health risk posed by COVID-19, there may be also some other factors to consider, such as job requirements, the ability or inability to work from home with your child or children, the mental health of your family, your child's need to socialize with peers, something that I've experienced, as my son has really struggled in the last week or so with this continued shelter in place, the need for our children to learn in a way many of us parents feel inadequate to provide. Again, something we're all wrestling with if you're a parent, and probably some additional factors that are unique to each child and each family. So a long-winded answer. I apologize for that, Sarah, but hopefully it got at your core question.
Definitely. No, I appreciate it. Can the virus survive on clothes and shoes, and how long, or do we know?
So to my knowledge, there's been no documented cases of transmission of the novel coronavirus via clothing and shoes at this point. But if you are taken care of or frequently in close proximity to an individual with COVID-19, doing laundry is obviously an essential part of preventive hygiene. And this includes in particular high-risk individuals such as healthcare workers. I'm assuming many of you have read, like I have, that many healthcare workers, when they arrive home, they derobe in their garage or outside in privacy and launder their clothing immediately upon getting inside. So most household detergents are sufficient to kill the virus when doing laundry. There are recommendations for reducing the risk of transmission, and the virus is thought to spread, again, mainly from person to person through those respiratory droplets. So consider the tips outlined in CDC's Running Essential Errands resource. It's one of our most highly viewed and shared social media videos. And that resource gives advice such as shopping for food and other household essential items online and using curbside pickup, staying at least 6 feet away from others when in lines, avoiding touching your eyes, nose, or mouth, and if possible, using touchless payment methods when possible. Of course, using disinfecting wipes frequently on touch surfaces such as handle, knobs, and touchpads, something that my wife is particularly a stickler on.
Great, thank you. We've received a lot of questions on the antibody tests. In particular, one question is, can it be considered a reliable indicator of what employees are considered immune to COVID-19 and which are not?
So at this time, it's premature to use antibody tests to determine whether individuals are immune to reinfection. There's still a lot more to learn about individual protection and whether antibodies A, protect against reinfection, and B, are long-lasting. That is to say, are they durable? So at this time, we don't know if having antibodies means immunity to SARS-CoV-2. At present, CDC does not recommend using antibody testing to diagnose acute infection. A viral test should be used instead for diagnosis. So negative test results from an antibody testing do not rule out SARS-CoV-2 infections, particularly for those individuals who have been exposed to the virus and are still within that estimated incubation period. Some people may take longer to develop antibodies, and some people may not develop antibodies. And so results from antibody testing should not be used as the sole basis to diagnose or exclude SARS-CoV-2 infections or to inform infection status. And CDC is a key contributor in efforts to understand the immune response and evaluate serological testing. The FDA has authorized emergency use of several antibody tests. So in collaboration with other government agencies, CDC is evaluating the performance of commercially manufactured antibody tests, and results from the initial federal evaluation are expected later this month and will be updated as more tests are evaluated. We're working closely with public health and private partners on how best to evaluate individual and population susceptibility to COVID-19 as the pandemic progresses. And I'll also mention that we published a paper in JAMA, the Journal of the American Medical Association, last week summarizing our current knowledge around the immune response and the key questions remaining for research. So I'd point you to that if you want some additional information.
Excellent, thank you. I'm going to turn things over to Jen for a couple questions. Jen, do you have any feedback on the cleaning of tubes, rafts that are utilized in water?
Sure. So, of course, we think it's important that shared objects like tubes and rafts be cleaned and disinfected between use. In terms of where this should happen, this is really more of an operations question that's very specific and unique to each venue. So it's best to carefully read the labels of the disinfectants that you choose to use and to contact the manufacturers of the objects, the venue surfaces, and maybe even the disinfectant itself to make sure that the disinfectant is compatible with the surfaces and the water chemistries in your venue.
Excellent, thank you. And kind of on line of that same question, a lot of questions about chlorinated water and how that can be used. Can that be used to properly disinfect an item like a raft or, say, a life vest?
Sure. So CDC, of course, recommends first cleaning shared objects and frequently touched surfaces, and then following that by disinfecting that surface or object using a disinfectant from EPA's list N. So these are specific disinfectants for SARS-CoV-2. So chlorine-based products are on list N. And we also have a dilution of generic household bleach included on our website as an option in case disinfectants on list N are not available. So this recipe, it produces a surface disinfectant that is about 1,000 milligrams per liter, 1,000 parts per million. So that's about 1,000 times more concentrated than properly treated pool water. So we really do just want to stick to recommending use of those disinfectants or this high concentration of household bleach, and not relying on pool water alone as your disinfectant for shared items and surfaces.
Excellent, thank you. And Jen, I'm going to keep it with you and ask just one last question as we're wrapping up. In regards to handrails, can you make any recommendations when it comes to cleaning handrails?
Sure, yeah, we get this question a lot. So focusing on high touch surfaces that need to be disinfected and at least daily. So this is handrails is one of those. So a suggestion is to really get into your facility before things open up and make an assessment. Look at the different surfaces that people will be touching frequently and really make a plan, and kind of setting a cleaning and disinfecting schedules would be a really good idea. We haven't included information on frequency of cleaning and disinfecting other than at least daily. Because we know this really varies a lot depending on the size of the facility and the time of day. It's really location dependent. So I think, yeah, just really thinking through that in advance, see what makes sense for your facility. We don't want to overuse disinfectants. So being careful to really plan that out, come up with a good plan and try to stick with that with your staff.
Excellent, thank you. So this concludes our Q&A. Grant and Jennifer, do you have any parting words or closing remarks?
No, I just want to express my appreciation to everybody on the line and for the shared commitment that we all have of doing what needs to be done to bend the curve on this pandemic. I know it's going to require us to live and act differently, but over time, I think we're going to quickly normalize those behaviors and appreciate everyone's hard work and commitment to getting through this together. Thanks again for being on the call. Jen, do you have any final words or thoughts?
I just wanted to echo that and to thank you all so much for your time today.
Excellent. So as I wrap up the call, I wanted to share with folks that we will not be facilitating a private sector call next Monday, the 25th. However, I'm pleased to share that this week, starting tomorrow through Friday, there will be a webinar series facilitated by Dr. Baldwin's team at the Community Intervention and At-Risk Task Force. There will be a webinar a day starting tomorrow, with the focus being on youth programs and camps. Wednesday, schools and childcare programs. Thursday, workplaces and mass transit. And Friday, youth sports. So I highly recommend folks take a look at those. If you've got any questions, I'm hoping that you're logged into the webinar platform and you can see the email, but I'll repeat it right now for those that are just using their telephones. You've got questions to submit or you want information to register, please email EOCEVENT357@cdc.gov. And again, that's EOCEVENT357@cdc.gov. And we greatly appreciate your time today. We hope that you'll come back and join the private sector calls starting the week after next. But in the meantime, we do hope that you'll join us later this week. Thank you so much for your time and have a good afternoon. Bye-bye.